Let's start.
Okay. Hi, I'm Dr. Vijaya Kattimani. I'm a pediatrician, consultant pediatrician and neonatologist. My designation, MBBS and MD Pediatrics. I have done my MBBS from BIMS, Belgaum and MD from Mysore Medical College, Karnataka. Okay, today, I take a second to thank BabyChakra for giving this opportunity to have a good session on the care of the child during monsoon. So today we are going to speak about monsoon skin allergies and kids. Okay, before starting to the session, now I will brief about monsoon skin allergies. Okay, let's start. So skin allergies, it covers the conditions that causes dryness and itchy red rashes of the skin, which mainly occurs due to exposure to some allergens or any irritants. So skin allergies, these are most common, like it is common in genetically prone individuals. It's not mandatory that it has to occur in only genetically prone individuals. It can occur in others too. So this skin allergy, how it gets triggered? It gets triggered by a series of reactions which will lead to increased production of antibodies and even the release of histamine, which will lead to most common symptoms, the dreadful symptom, that is itching, which is bothers kids too and even parents too. So coming to the skin allergy, there are many types. First, skin allergy, the most common, the kids and even the parents presents with the red raised itchy patches. So that is urticaria, which even called as hives. So this urticaria, it can be due to infection also. Most commonly viral infection or post-viral infections. Like you have heard about measles, and even in dengue cases, and even rickettsial infection, bacterial infections like staphylococcus, streptococcus, and many other infection can lead to skin allergies in kids. Even it can occur due to many food items too. Food items. So coming to food items, we have heard many parents saying that the child has allergy, doctor, the child has developed allergy after eating this, that. Like most commonly, child develop allergy to food substances like egg yolk, even milk, soya, cashew, fish, and many other goes on. But for this food allergy, the detailed history and even maintenance of food diary is important. And even coming to the third cause is medications. A doctor usually prescribe the medication with the good intention of curing the kid or whatever the patients. But this whatever drug reaction, it can occur any of them. Like this drug reaction can occur even to a simple medication also, even for antipyretic like paracetamol also, a child or a patient can have drug reaction. So never blame a doctor, because these drug reactions, these occurs to pharmacogenetics. There is a word called pharmacogenetics, because these skin allergies, these are mainly due to genetic contribution, epigenetics, environmental factors. So any medication might have caused the skin allergies, and most commonly insect bites. Insect bite, even some NRI kids and whatever, like because of the change in extreme cold or hot environment, child will develop insect allergy. Even to a mosquito also, they will develop allergy. Mosquito bite, sting bite, whatever might be, it might be some of the new insects, they will suddenly develop allergies. And even exposure to sunlight also can cause skin allergy. So these all skin allergies will come under urticaria, that is infections, food, medication, drugs, insect bite, and any other change in environment or sunlight. And again, there's another entity called atopic dermatitis. Like there will be always history of genetically prone individuals. Means whenever there is a family history, whenever the patients or kids, when they will come with history of skin allergy, will ask whether any one of the parents has the same. Otherwise, any of the family members has members have, like whether there's a history of similar complaints in the family, otherwise their ancestors. But it's not always holds the same. So atopic dermatitis, it applies to the kids when there's a chronic skin allergy more than 6 weeks. So always they will present with itching will be there around face, neck, and flexural forces of the arms, otherwise flexural surfaces of the body. So that is atopic dermatitis. These atopic dermatitis kids, most commonly, they will have asthma, otherwise there will be early diseases in later life also, and even during their childhood period also. Then coming to contact dermatitis, skin allergies, they will cause due to contact dermatitis. This word itself explains that if there will be skin allergy, otherwise skin rash will develop soon after contact with that object. Like it might be due to allergens like it might be due to any cosmetics or cosmetics, like especially in the newborns, in the infants, we have a tradition to put any necklaces, anklets, some thread, dhaga. Those all things will cause itching in genetically prone kids also, and even normal kids also. And mainly diaper dermatitis. Soon after, some kids, they will use diaper. Diaper also will cause diaper dermatitis, which will come in both contact dermatitis and even nickel, some silver ornaments, otherwise steel, whatever. They will use dhaga, especially in our tradition, to keep evil eyes from our kids. Okay, this will cause allergic dermatitis. Fine. And even any cosmetics also, like if you can observe, some of the kids, they don't develop any reaction to some of the lotions, some of the kadi, like kajal, even powder also, even some of the lotions also, they won't get the skin rashes. Whereas some other kids, they will have the skin allergy to the same products. So it just depends on the genetics and epigenetics and environmental factors. This is called allergic contact dermatitis. And another one is irritant. Irritant, it might be due to anything. Soaps. Coming to the soaps. Soaps also can cause irritant, like this contact dermatitis. And some of the, like some people will be having pet in their home, that pet ka saliva, whatever things, this will also cause the contact dermatitis. So brief about this skin allergies, it can be articular allergies, atopic dermatitis, or contact dermatitis, which might be due to allergens or irritants, like even diaper dermatitis too. So this is brief about the skin allergies. So it is just a result of complex interaction between genetics, environmental, and epigenetic factors. So genetically prone individual means they will be having low tolerance, low threshold, means even some of the allergies, some of the contact with allergies will also cause allergic reaction. But some of the parents, they will come up with a history that, no doctor, we used to give this food earlier also, now suddenly how can the child can develop the allergies? It's not a fact, because allergy can happen over the time also. Like earlier the child have, like whenever that we have given some food, otherwise medication, it's just like a sensitization of the child neuronal and humoral immunity to that substance. So like repeated exposure to that allergen, otherwise irritants, otherwise food, otherwise medication, over the time, it will cause very bad reaction, very bad skin allergies. So this thing parents have to keep in mind, that it's not like that it has to occur on the first time only. Fine. So this is on a brief about skin allergies during monsoon. As monsoon is approaching, now we will face dryness of the skin, those things. So let's discuss about these things. If any queries, I am ready to answer. So just now I have briefed you about the skin allergies in brief and its types. So let's go through the questions. Naina? Naina? Okay. So first question they have asked is, so their question is that my 6-year-old child has developed redness in thigh areas. So how can I do the management of this redness? Okay. So here the child has presented with redness in thigh areas. So it means that it is an articular rash, which can also be called as hives. Articular rashes means these are red raised patches. It can present over any side. Here the child has presented with on thighs. So articular rashes. So these articular rashes are, as I have told, it is a red raised itchy patches. It can be caused to many things. So these are articular rashes. It can be mainly due to, as I've told, food allergies. Food allergies like egg, milk, wheat, fish, cashew, soya. These all foods in some of the kids, they will cause very severe allergies. And as we have discussed, infections also. If it is a bacterial infection, so do consult your doctor, because there will be history of fever with any allergies like skin rash. Whenever there is a fever with skin rash, you have to consult your doctor. They will diagnose and they will give the treatment accordingly. And even if there is any medication, it may occur soon after also, soon few hours after consumption of medication also. That thing you people have to keep in mind. If any child has developed any rashes like this, articular rashes following the medication, make sure that you will consult your doctor as soon as possible. Because in some of the condition, there will be swelling of the lips, swelling of the necks, this swelling of the neck, which can compress the trachea and may lead to breathlessness, difficulty in breathing. That is known as angioedema. Whenever there is an angioedema, it needs emergency treatment, immediate attention of a doctor. Okay, so it could be due to food allergies, medications, any infections also, any sting bites, insect bites. Insect bite, it can be anything. Some kids, they will develop allergy like this articular rashes, even to cockroach also, even dust mites also. It might be anything. Any of the organism can cause skin allergy to any of the individual, depending on the individual genetic susceptibility, individual genetic tolerance to that insect, otherwise that allergens. Fine. It might be like, otherwise it could be due to contact allergic dermatitis, like pollen, dust, mite, those all things. Otherwise, if it is whatever now at present, the child has present with the recent history, means the child has present with the acute articular rash, means red raised patches less than 6 weeks. Whenever it is less than 6 weeks, 6 hafta, then we'll consider as an acute articular reaction. So we'll find out the cause depending on this one, then we'll treat. So how can we treat? First thing, most of the times when it is a skin allergy, articular rash, it is self-limiting. And it is most commonly, it is a transient. What is meant by transient? Transient, it may exist and soon it will disappear. Again, it will appear, disappear. That is known as transient. So don't worry. If it is because of the post-viral, it will heal by itself. Otherwise, you have to take care of the skin. So how can you take care of the skin? Skin, use lukewarm water for bathing, and don't rub the skin while like soon after the bath. Just tap dry the skin. Fine. Then use non-alkali soaps, like the soaps which have pH of 5.5 and those all things. And don't use showers. Avoid showers. Avoid bubble bath. Fine. Like this. And even if comes to clothes, use cotton clothes. Don't like avoid direct contact of skin with the woolen clothes. And you have to cover the kid entirely so that they have to avoid these reactions too. So these things you can do, and you have to find out the thing which has caused the allergy. If it is food, avoid that food. If it is the medication or syrups, avoid that syrup throughout. And for moisturization, otherwise for some for soothing, you can use calamine lotions. Otherwise, very good and effective moisturizer whichever has been prescribed by your consulting doctor or pediatrician. And if there is any history of allergy, otherwise, if there is a lot of severity, then you have to go for oral medications which are non-drowsy. Means there are types in antihistaminics. I've already told you these skin allergies, they occurs due to increased antibody immunoglobulin E production and histamine release. So here we have to use medications which are antihistaminics, which contains both sedative, non-sedative. Either you can go for cetirizine, fexofenadine, loratadine containing medications, or hydroxyzine. Fine. Then if it is very severe acute reactions, that time you have to consult your doctor SOS. Don't self-medicate yourself. So this will be the treatment for this question, that is articular rashes and the treatment. So one thing, so how will you treat articular rashes? First, take care of the skin. It is a self-limiting. If there is a itching or more severe, then depending on the site, depending on the place, severity, depending on the age of the kid, doctor will take proper dosage and duration of what medication, oral medication has to be taken, and even what in case of skin allergies, we use topical mild potent corticosteroids. So this one will be selected by your consultant doctors and pediatrician only. Don't medicate yourself on Googling. Google doctor is dangerous. It has its own side effects. So do consult a doctor, because it's a kid. It's your kid whom you are going to treat with. So you need a very good practitioner, the knowledgeable doctor, to treat your baby. So that time you have to choose very good emollient or moisturizer, which will maintain the hydration of the skin, which will decrease these reactions, articular reactions, and antihistaminic oral medication and steroids. Steroid use you have to use for the specific duration as prescribed by the doctor. Even the more longer period of usage of this corticosteroid will also cause very bad side effects like dryness of the skin, even the bleeding. So be careful. Fine. So coming to the next question, Naina. So coming to the third question, here one mother, she has asked the question that how to treat fungal infection during monsoons, as my child has fungal infection in a toe. Fine. So coming to this question, so according to the question here, we can see that the child has got fungal infection of the nail. It is in medical term, it is called as tinea pedis. Pedis means like involving toes, fingers and toes. If it is over the neck, otherwise if it is over the abdomen, it will be called as tinea corporis. If it involves a scalp, then we'll call it as a tinea capitis. Depending on the site, we'll use different terms. So this is a case of tinea pedis. So here her baby has been got fungal infection. So let us brief about the fungal infection first. Fungal infection. Yeah, fungal infection at present is a global alarm kind, because nearly 36.6 to 78.4% of the population, they are suffering with the fungal infections. So fungal infection, how it will be caused? What are the causes for the fungal infection? First one, as you people know, it is monsoon. Monsoon will also cause a fungal infection. Monsoon and even extreme weather changes like humid and water. Second one, low standards of hygiene. It's not always mean that hygiene, standards of hygiene. Whenever we tell that you have to maintain a hygiene to the parents, they will tell that, what doctor, we are maintaining a good hygiene. Still, you are telling that we have low standards of a hygiene. It doesn't mean in that way. I'll just explain you later. So hygiene and even overcrowding, it's not always mean that some of the parents have a doubt that how can he get fungal infection? We are keeping him very clean also, tidy also. So here even nutritional deficiency can also lead to fungal infection, and even environmental factors, some sharing of the clothes, sharing of the clothes, otherwise contact of the person with who has fungal infection. Many of the times we have faced, like if child presents with a fungal infection, we make sure that, and we have to rule that whether the one of the parents, otherwise any one of the family members have the same fungal infections, because fungal infection, they will present with a very bad itching. So whenever they will itch somewhere where they have fungal infection, whatever that secretion, if they touch, and if they touch over the any other place, that time what happens, there will be the that infection will spread. So these are the causes of fungal infection. So how can we treat here? See, fungal infection, they will be having very bad itching. Itching is the main complaint they will present, and it will be spreading. So itching, I'll tell you in detail how to treat a itch. Then what are the antifungal medication you can use for a fungal infection of a nail? Here, you have to consult your doctor, because depending on the site of the fungal infection, even the size, severity of the fungal infection, even depending on the itch, about the itch, how much itch has the child has, depending on that one, everything will differ, even treatment will differ. Because if fungal infection is involving nails, it has a different treatment. If it involves a neck, if it involves abdomen, everything has a different treatment. So kindly, if you feel that your child has got fungal infection, otherwise any of the family member, do consult your doctor. Don't self-medicate, because it has its own side effect. Because in fungal medications, if any steroids are used, then it will aggravate, it will increases the spread of infection. So do keep this one in mind. So how can we treat? You have to use topical antifungal agents. What like in our terms, nystatin cream, powder, 1% clotrimazole, 1% terbinafine, 2% ketoconazole creams, lotions, shampoos, and even 2% luliconazole, miconazole, gentian violet. These are all the topical antifungal which has to be used on the site for a specific period. Duration depends on the things. Sometimes it will take a long time, even months together. We have prescribed antifungal treatment even for 6 months also to get rid of the fungal infections. Along with the, depending on the age, if the child is more than 12 years, then we'll go for even antifungal medications too. And main thing, itching, we have to treat the itching, which are antihistaminics, non-sedative or sedative first generation antihistaminics, depending on baby's age, weight, will decide the decide the dosage and how much duration it has to be given, because it has it has to come down, because this itching again will aggravate the fungal infection. So in this fungal infection, we have to treat itching and fungal infection very effectively, because here kids or the patients who has a fungal infection, they'll itch for a relief. Okay, this is about the fungal infection of the nail, that is also called as a tinea pedis. It has to be treated like this. And even the maintenance of the cleanliness of the toes is very important. And some of the dermatologists and even the pediatrician, they will surely will tell to use nail on lacquer antifungal lacquers, just like a nail paint. It has to be applied over the nails of the kids who is suffering with the fungal infection of the nail. Okay, this is about the fungal infection. Then coming to the next question. Next question is, okay, here one of the mother, they have asked a question, how to manage the itching as my kid is constantly itching. Like he will be always scratching because of the skin allergy in this monsoon also, and recurrently he will be having itching with the skin allergy. So how can I deal with my baby? So for this one, so coming to the itching or pruritus, so like we should worry about the skin allergy, because skin allergy mainly causes what? Itching. So itching is the chief complaint. It is the main complaint of the children who presents with the skin allergies. So itching, it is multifaceted symptom which will affect the quality of life of a kid very badly, because whenever there is a itch, it will cause like whenever there is a itching, it will lead to the scratching. So this the scratching, what does it do? It will break the skin barrier system. It will lead to eczematous skin lesions. Again, it will lead to the itching. Itching will lead to scratching. So there is a itch scratch cycle. So Because of this itch scratch cycle, this infection will spread very fastly, and because of itch scratch, if doesn't get controlled, then it will lead to the very bad outcome. Child will present with the very bad skin conditions, because we know skin act as a bacteria, act as a barrier against external, whatever it might be, allergens, contacts, everything. If the skin integrity, if skin's thermoregulation, temperature regulation, if it is get altered, then the child will have itching. Itching, it might be due to change in humoral and humoral immunity also. And this itching, it occurs due to activation of muscarinic and neuronic receptors which are present in the skin. So this is about the big physiology of the itching. So itching, whenever the child present with the itching, the main aim should be to prevent the itching, because itching, what does it will cause? It will cause irritation in the kid, poor concentration, child will be irritated, and if there is a itching in the night, it will cause night disturbances also, which will be a headache to both the kids also and the parents also. Nocturnal, if there is alteration in the sleep, it will alter his daytime activities, including the food pattern also. So overall, this itching will lead to a lot of problems, nocturnal disturbances, and even psychosociologic effect also, which will make tiring to both the kids and parents. So whenever there is a itching, so how can we treat this itching? Itching needs a multifaceted approach. So if there is a good skin care, then we can prevent this itching. So to prevent itching, first, use very good and effective, very liberal use of moisturizers. Consult your doctor, just choose, otherwise they will consult you, otherwise they will prescribe a very good and effective either emollients or moisturizer, which will maintain the hydration, of the skin. So whatever the skin barrier system will be restored, and there will be decrease in the itching and reduce the discomfort of the itching. So first thing, you have to liberally use the moisturizer, otherwise emollients. This moisturizer, keep it in a mind, soon after bathing, within 3 minutes, it has to be applied on the wet skin. Fine. Then identify the allergens which are causing itching. It might be food allergy, it might be medications, it might be any infection, either bacterial or viral. These all causes. Otherwise, it might be a fungal infection which might be causing. Otherwise, any contact dermatitis like any metals, otherwise diaper dermatitis. After that, then you have to use oral medications like antihistaminics and mild potent corticosteroids on local applications. Mild potent, these corticosteroids has its own effects also, side effects also. Whatever the duration, it depends on the size and the severity. Do consult your doctor. Then if it is caused due to any food, you have to avoid that food. That should be kept in mind. And how about care at home? Parents, they should use cotton cloths only. They have to avoid direct contact of skin with the woolen clothes. It's not mean that you should not put woolen clothes at all. Put the cotton clothes inside. After that, just cover it with the woolen clothes. And you have to pack your kids entirely, so that they should not get a chance to scratch their skin parts. And you should use non-alkali soaps too. Okay. Then lastly, in the questions at the end, they have asked the question. So in these monsoons, at the entirely, how can we take care of the skin? So at the end, parents, these are some tips, some advices to take care of your kids' skin and to prevent skin allergies, rashes, whatever the fungal infections. First thing, how to take care of the skin. Skin, you have to use lukewarm water for the bathing. That is first. Use non-alkali soaps. Okay. And you have to encourage your kids for the swimming. It will increases the skin barrier system. You have to avoid shower, bubble bathing, and never ever rub the skin, just tap dry the skin. Second, coming to the clothes, use cotton cloths, avoid woolen clothes and its direct contact with the skin, and cover your child very fully so that they will not scratch anymore. And you have to use very good moisturizer, which should be applied within the 3 minutes of after bathing. or on wet skin. And coming to the diet, the mother, they have to exclusively breastfeed for 6 months. There are the records that the kid who have been exclusively breastfed for 6 months, they have less incidences of skin rash. So do breastfeed your kid for 6 months, and do start complementary food, whatever the food, after 6 months. And don't stop giving any food until unless your doctor tells that you have to stop this food as your child has got allergy to this one. Fine. Never ever stop any of the foods until unless your doctor advises. And how can you take care of the environment? Your bed sheet, everything will be sun dried. That is important. And for allergy, you just avoid stuffed toys, soft toys, avoid carpets in the home, avoid extreme hot or cold weather, and avoid whatever the triggering factors, allergens, food, medications. And coming to the medical care, always consult your doctor. Even if your child has improved from the skin allergies also, go for the follow-up. Do not self-medicate. Do not use whatever the steroid creams in case of the allergies for a longer period. Just consult, depending on the size, severity, your doctor will consult proper dosage and proper duration. And do supplement your kids with vitamin D during their during their neonatal life also, and infant life also. Otherwise, till 2 years, if there is a vitamin deficiency. And at the end, the best point, if your child has an allergy to the something, either it might be some food like cashew, do write on a label, keep it in a bag. Otherwise, do a bracelet to your kid, and do inform their school teachers, so that any accidental ingestion of any food allergies which will cause skin allergies has to be avoided, because they will cause very bad skin allergies, rashes. So this is about skin allergies in monsoon. Hope so. This session will help you in some or the other ways. So take care of your kids, and this monsoon, take care of your skin, your kid skin with good moisturizer, and keep your child skin dehydrated. And if it is allergy, avoid that allergens. If it is a fungal infection, make sure that you consult your doctor and take antifungal medications. Thank you once again for the patient listening, and thank you BabyChakra for this live streaming. Thank you one and all.